What predisposes to gallstones?
Some people we see that they are more prone to gallstones and some people are not. There are multiple factors like hypersecretors. People with diabetes are more predisposed to have gallstones.
Then what are some protective factors for gallstones?
Vitamin C. These are some protective factors which can reduce the formation of gallstones.
What are some common symptoms for patients having gallstones?
Around 75% patients with gallstones asymptomatic. They are not having any symptoms. 20% patients have pain in their abdomen. Most of the time people misunderstand pain of gallstone as pain of acidity, bloating like this. Gallstone pain is usually periodic.
Hello everyone, I am Dr. Riya Saha, MD General Medicine, and here we have with us Dr. Krishanu, DM gastroenterologist, gold medalist, and sir has started ERCP in Kolani now. And so today we have chosen the topic for our discussion to be gallstones and gallstone diseases. So welcome sir in today's
Good evening.
episode. And since you have started ERCP, this is a very poignant topic to discuss
Yes.
today.
Right.
So, coming to our discussion, what predisposes to gallstones? What
Yes,
are the risk factors?
that's a very pertinent question because some people we see that they are more prone to gallstones and some people are not. So it is important to know for common people also that which conditions can predispose to gallstones. There are multiple factors like some internal factors which we call as hypersecretors. Those people who are secreting more biles through their hepatobiliary systems are more predisposed to gallstones. And there are some genetic factors. There are some specific genes which can predispose to gallstone formation, and there are some factors. There are some enzymes or proteins within our body which can predispose to gallstone, and there are some factors which reduce the formation of gallstones. So people who are enriched with these pro-nucleating factor or pro-gallstone formating factors are more likely to have gallstones. These are internal matters, and there are some other factors also like female gender. Females are more predisposed to gallstone formation than males. So it has been seen that for any age group, females are twice more predisposed to gallstone formation than males. And increasing age, as age increases, there is increased chance of gallstone formation up to a certain age. Then the rate of gallstone formation decreases. Those who have diabetes, those who are obese, having higher body weight, higher than normal body weight, and some people who are losing weight very rapidly. So these people are more likely to develop gallstones. And those who are diabetic, having diabetes mellitus, as we know that India is now considered to be the diabetes capital of the world. So people with diabetes are more predisposed to have gallstones. There are certain medications which can predispose to gallstones, like there is an antibiotic called ceftriaxone. Ceftriaxone can predispose to gallstones, and there is a oral medicine to reduce our lipid, like fibrate group of drugs or medicines. These can lead to formation of gallstones. Some hospitalized patients who are hospitalized for prolonged period, they are immobile for longer periods, and those who are not taking any oral diet, who are dependent on parenteral nutrition or nutrition through IV saline, this group of people are more likely to have gallstones. So these are the factors which predispose to gallstones.
Okay. Then what are some protective factors for gallstones?
Yes, there are some protective factors like vitamin C, drinking coffee, statin group of drugs like atorvastatin, rosuvastatin. These drugs or these medicines are used to treat high cholesterol level. These are some protective factors which can reduce the formation of gallstone.
Okay. So then, what are some common symptoms and symptoms for patients having gallstones?
Most of the time, around 75% patients with gallstones are asymptomatic. They are not having any symptoms, and like 20% patients have pain in their abdomen. So most gallstones are diagnosed incidentally. Suppose person is going for an ultrasound of abdomen for some other reasons, it can detect gallstones. He's completely asymptomatic. He's not having any particular symptom of gallstone. But in these people, 75% of people like these have gallstones on ultrasonography, and 20% people have abdominal pain for gallstones. Some 10% people have complicated gallstones disease like cholecystitis. So, in most of the cases, people are asymptomatic, and the most common symptom of gallstone is pain in abdomen.
When a patient of gallstone is having pain, then for patients, what is the cue to thinking that the pain may be from gallstone? That is what are the characteristics that differentiates the pain of gallstones from other causes of pain
Yes, yes.
abdomen?
This is very important point, because most of the time people misunderstand pain of gallstone as pain of acidity or bloating like this, but it can be easily differentiated. Gallstone pain is usually periodic. It does not occur every day. It comes and goes after a certain interval. Suppose after a period of 15 days or after a period of 1 month, like this. And when the pain comes, it is constant, deep pain. It is severe pain. It's severe enough to make a patient toss over bed, or to go to the hospital for an injection at midnight, and it stays for more than 30 minutes to 1 hour. And as it is a severe pain, mostly in the upper part of abdomen, mostly in the central part of abdomen. So please do not misunderstand this type of pain in upper abdomen to be due to acidity or something like minor disorders. And gallstone pain is usually associated nausea. Sometimes vomiting can occur, and it may radiate towards the back, or it may radiate towards the shoulder. So the simplest way to differentiate pain of gallstone from acidity like disorder is its severity, periodicity, and duration. Gallstone pain would be more severe, it will be periodic rather than daily pain, and it is more severe and persistent when it comes.
Okay. Then, when a patient has gallstones, when does the patient need to go for treatment?
Yes, in general, patients who are asymptomatic, we do not offer any treatment. But once the patient is having symptom, that is pain for gallstone, we offer treatment. But yes, in some asymptomatic patients, we offer treatment. There are groups of patients with gallstone who are asymptomatic but still require treatment, are patients with sickle cell disease. There is a blood disorder called sickle cell anemia. In those patients, if he is having gallstone with sickle cell disease, we offer cholecystectomy or removal of gallbladder. If gallstone, in case of porcelain gallbladder, there is a term called porcelain gallbladder, which the gallstone wall is calcified, and it appears as a bright globular structure on X-ray or ultrasonography. So this condition can predispose to cancer of gallbladder. So porcelain gallbladder, when gallstone is associated with large adenomatous tumor of gallbladder, or there are some liver disorder called Caroli's disease or choledochal cyst, when the bile duct is dilated. So in this condition, even if the patient is asymptomatic, we offer treatment for gallstone. And some people, those who are waiting for a heart lung transplant, gallstone treatment, because once there is pain due to gallstone or complication due to gallstone after heart lung transplantation, it has a high mortality. So, asymptomatic gallstone disease in patients awaiting for heart lung transplant need treatment. And for astronauts, if there is asymptomatic gallstone, they need treatment. So, this group of people, even if their gallstone is not causing any symptom, still they require treatment in the form of cholecystectomy or removal of gallbladder.
So what happens if one who needs a treatment doesn't go for treatment? How can it get complicated?
Yes, this is also very important to know that once gallbladder pain occurs due to gallstone, uh, the chance of developing for symptomatic patient, those who are not having any symptom, they have a chance of 20% getting pain due to gallstone in next 10 years. Once pain occurs, then the chance of complication increases, and the chance of complication in asymptomatic patients, where the chance of complication is 10% or less, it becomes more than 25 to 30% in those who
The
develop
symptoms.
pain. So it is very important to get treated once there is pain in gallstones.
Then coming to the treatment part, what are the modes of treatment that are available for treating gallstones?
Yes, the treatment portion is divided into two parts. One is medical treatment and one is surgical treatment. So, medical treatment means we treat gallstones with some medicines, and surgical treatment constitutes both endoscopic treatment and surgical treatment per se. So, in medical treatment, we treat gallstones with medicines like ursodeoxycholic acid, and in surgical treatment, we treat gallstone disease by ERCP, which is required for gallstone when it comes into the bile duct, or operation in the form of operation.
Coming to the surgical parts, can you please elaborate on the endoscopic procedures?
Yes, endoscopic procedure is most commonly used for gallstone which is in the bile duct. Once a gallstone comes into the bile duct, it is taken as a complication of gallstone disease, and it has to be extracted by means of ERCP, that is endoscopic retrograde cholangiopancreatogram. And there are some other endoscopic treatment also. Suppose a patient who is not a candidate for surgery, or who is not going to tolerate a surgery but requires surgical treatment. In these patients, suppose patients who are admitted in ICU, those who are having poor heart condition or poor renal function, these people may be treated in case of symptomatic or complicated gallstone disease by means of endoscopic gallbladder drainage in the form of placement of a drain in between gallbladder and stomach or duodenum. This is called endoscopic cholecystoduodenostomy or cholecystogastrostomy. So these are the endoscopic treatments of gallstone.
Okay. So then coming to the medical management part, suppose a patient is getting treated with ursodeoxycholic acid and the patient has responded. So what are the chances of recurrence?
First, we should know that medical therapy is not for all. Medical therapy requires some preconditions like a functioning gallbladder. If the gallbladder is functioning properly, then only medical therapy can be applied. If the gallstone is radiolucent or has a low density, which means the cholesterol portion of the gallstone is higher, they can be treated by medical therapy. And the size of gallstone needs to be less than 10 millimeter, preferably less than 6 millimeter. So functioning gallbladder patient, symptomatic patient, functioning gallbladder, small gallstones, and gallstone rich in cholesterol. So these are the preconditions for medical therapy, but other than these, we do not offer medical therapy. And once we start medicine for gallstone, it generally requires a continuation for 2 years or more. And this type of medicine is a bit costly, so continuation of therapy for 2 years or more is on pretty higher side. And once the treatment is stopped, suppose the gallstone has abolished by medicine, there is a 50% chance of recurrence of gallstone within next 5 years. So these are the drawbacks of medical therapy.
So then, after having discussed everything, what is the role of a consultant and a gastroenterologist? If you please elaborate in treating a gallstone disease.
Yes, first of all, the most important part of a consultant physician is to make people aware about what kind of pain a gallstone can have. So most of the time, we cannot differentiate. We common people cannot differentiate a gallbladder pain from other types of pain in abdomen. So as we have discussed the character of gallstone pain, so it is the most important part of a physician to correctly identify that this pain is not due to acidity, and this pain is due to gallstone, and advise proper investigation. And a role of a gastroenterologist is including this part to offer the patient correct treatment, whether patient can have a successful medical therapy or they need endoscopic or surgical therapy. If endoscopic therapy is required, then it is the role of a gastroenterologist to provide this. And if it is not manageable by endoscopic therapy, then to suggest the patient to visit a surgeon. So this differentiating this gallstone pain from other causes of pain and prescribing the correct mode of therapy is the role of physician and gastrophysicians.
Okay. Thank you, sir, for such a lucid discussion on a very common topic.
Yes.
And I hope patients and viewers can get a clear idea from this discussion. And do not wait and go forward if you have symptoms such as these, and seek treatment.
Thank you.